All right. So what we've done is we've surveyed over 1,700 people with Parkinson's, and we're looking for different variables associated with faster and slower rates of progression. And what has come up as amazing to us is that the single biggest predictor associated with progression is loneliness. If people answer true to the statement, "I am lonely," loneliness is worse for you than 7 days a week of exercise is good for you. And so what we're doing here with these data is kind of starting to break down the information on loneliness and what does that mean for a person with Parkinson's. So what we're seeing here is that this is the overall Parkinson's symptom severity. So this is what severity looks like among people who are not lonely. This is what severity looks like among people who are lonely. So you can see people with Parkinson's who are lonely are about 30% worse than their non-lonely counterparts. What we did is we used a patient-reported outcome scale, and this over here we're just showing that as the Parkinson's symptom severity increases, gets worse on the PRO-PD, so does your social health get worse. So we do know that this scale looks to be a pretty good indicator of overall quality of life and social health. And so what we're really trying to do is, this is kind of this new emerging idea in Parkinson's disease, is that by the time you're diagnosed, you're actually already had Parkinson's for a decade or two. And so in this early prodromal phase, it's too early to give people dopamine therapies because they don't have motor symptoms yet, but they still have Parkinson's. And so what we want to do is get to people early, diagnose them early, and start to pursue some of these non-dopaminergic interventions like diet and exercise and social health. So I think targeting social networks, isolation, apathy, some of these symptoms that contribute to social isolation like depression, anxiety, drooling. What we're trying to do is if we can start to make isolation and loneliness a part of the clinic visit with patients, I think we can do a better job expanding and targeting the entire overall Parkinson's progression. And then this last graph over here, what's really neat about that is we associate Parkinson's with tremor. And so what these data over here say is that tremor is actually a worse predictor of overall health and Parkinson's symptoms than loneliness. So, even though a tremor gets all the attention in Parkinson's disease, tremor is not nearly as bad for you or as much of a risk factor for progression as is loneliness. So I think the whole point of our presentation here, this poster, is that it's maybe time to shift our focus away from the motor symptoms that the physician can see to the social health symptoms that the patient is experiencing. Thanks.